Chapter 2, Patient Registration. Topic, Test Request Forms. Test request forms are generated by the prescribing doctor and are processed further in the laboratory. Therefore, a test request form acts as a communication link between the prescribing doctor and the laboratory. Test requests are generated by the prescribing doctor and are processed further in the lab. Every request for test by the clinician should be accompanied by a written form which includes patient identification, gender, date of birth, contact details, and unique identifier of the patient, the name of the clinician or healthcare provider, the type of primary sample, and where relevant, the anatomic site of origin, the type of test requested, clinically relevant patient information. It can also include information about patient's ancestry, family history, travel and exposure history, any history of communicable diseases, or medication. This is a sample test request form, the prescription by the clinician. It includes all the relevant details as mentioned in the previous slide. Test request form, laboratory. Laboratory testing is an essential part of clinical decision making process because it provides the majority of critical information required for making timely and informed decisions for patient care. Data entry should begin as soon as registration number is assigned to the patient in OPD collections or at the time of test ordering or sample receipt from the ward and referrals. If a request form, also known as TRF, generated at the point of registration, it must ensure that all the data enumerated in ISO 15189 2012 are incorporated. Alternatively, the physician generated prescription may be used for identification and tracking of the sample. Whichever is the system chosen, the process must be suitably defined. The data entered should include billing information, unique identifying number, date and time of registration. Information generated at the collection point should have date and time of collection, tube or container information, any urgent request, and sample rejections. Financial information for billing purposes, financial audit, resource management, and utilization reviews may also be collected. The patient should be aware of the information collected and the purpose for which it has been collected. Date and time of primary sample collection in OPD collections, date and time of sample receipt in the event of ward or referral samples must be noted. This is a sample microbiology request form. The details requested for in this format are the demographics of the patient, which include name of the patient, date, age, and gender. Specimen information includes lab reference number, the specimen submitted, specimen collection date and time, the collection of sample by, site of collection, test requested for, and the sample received by. Clinical information would include the signs and symptoms the patient is suffering from, any history of antibiotic intake, and any other medical illness, comorbidities, and relevant clinical information. This is a sample influenza A H1N1 request and history form. It includes important details like date of reporting, name, age, address, gender, and telephone number of the patient, the symptoms of the patient like fever, cough, running nose, vomiting, pain abdomen, loose motion, any other. History of travel to affected area with H1N1 confirmed. History of contact with H1N1 confirmed cases. History of any other comorbidities like diabetes, HIV, etc. The sample collected and the time of collection and the date of collection. This is another sample test request form which includes all relevant details that need to be mentioned in a test request form. Significance of recording details on the lab TRF. The lab request form acts as a communication link between the requesting physician, the laboratory, and the patients. Important aspects of TRF. Inadequate information or error arising from process of filling out a lab request form may significantly impact the quality of lab results and finally the patient outcome. Insufficient
information or
information
omission of
or omission
information
of
on the lab request
information
form may
on the
lead to
test request
laboratory
form
errors,
may
make
lead
result
to
interpretation
laboratory
difficult,
errors,
delay
make
communications with
result
the requesting
interpretation
physician, more
difficult,
so in patients with
delay
life threatening medical
communications with the
conditions, and
requesting physician, more
misidentification of
so
either
in
the patient
patients
or the
with
requested
critical
test.
medical conditions, and misidentification of either the patient or the requested test. Therefore, interpreting test request form details helps us in clinical and critical decision making process by ensuring that the right assay is being performed on the right sample from the right person, leading to right result at the right time and right place.